Selamat pagi, Bapak Menteri Kesehatan, Pak Budi. Terima kasih atas kesempatannya. Saya Elizabeth Page dari Clan Child Health. Would it be okay if we continue the interview in English?
Sure, Elizabeth.
Thank
Although
you.
your Indonesian is much better than my Australian.
Thank you very much. Thank you so much for taking this time to meet with me to talk about newborn screening in Indonesia. It's a great privilege to be able to speak to you and hear about the amazing progress that Indonesia has been making. Just over the last year, in 2023, Indonesia reached 1.2 million babies screened. This is a massive feat, and I think a lot of countries across the world can learn a lot from Indonesia and what you have achieved so far. So to begin with, can I ask, why is newborn screening a priority for Indonesia?
Our child mortality is very high in Indonesia. I think we are top 10 in the world. So that is the target of the president. So when we review why it is very high, one of the things that we haven't done compared with other countries is newborn screening, to my personal surprise. Other developing countries already doing it, and some of the newborn screening can avoid mental or intellectual or physical disorder, but some of them are also very important to avoid fatality. So that's why we started this initiative last year. And actually I received these ideas from my colleague, Professor Aman Pulungan. He is a very passionate pediatrician, and he keep nagging me that saying that this is extremely important. This is extremely important, and we are one of the countries that is left behind. So that's why we push this initiative, and thanks to everyone, then the numbers is keep increasing. Number of screening every week. I monitor this bi-weekly, basically. Before I'm doing it every week, but now because the progress is there, and we are monitoring it on bi-weekly basis.
So newborn screening is really crucial to addressing the infant mortality rates. So at this point, I'd like to get an idea of the current status of newborn screening in Indonesia. Could you tell me what conditions you screen for currently and why these were chosen?
This newborn screening, we have 4.8 million babies every year. And for your information, it is like the population of Singapore, which is 5 million so 5 million people. So every year, Indonesia add almost one Singapore every year. And as I mentioned to you, the child mortality is 19 for every 1,000. And we have a target to reduce it to 10. But to my surprise, when I compare with other countries, they're even below 5. So they are even below 5 for every 1,000. So I said to the team, this is ridiculous. We have so many babies die unnecessarily. So that's why starting this year, all newborn babies we screen, starting with congenital hypothyroid, which I believe is not to avoid fatality, but to avoid intellectual disorder. But this year I asked them, because the system are already working, we can add additional 2 newborn screening tests, which is the congenital adrenal hyperplasia and G6PD.
Okay.
I'm not a medical doctor, but somebody told me this is a glucose 6-phosphate dehydrogenations, whatever it is. But those 2 tests can avoid fatality, which is very important to reduce from 19 deaths for every 1,000 to my personal ambition below 10 for every 1,000.
So currently screening for congenital hypothyroidism, but this year starting to screen for more diseases. So you mentioned that Indonesia has a lot of babies born each year. You're the 5th highest birth rate in the world. What percentage of these newborns in Indonesia are currently being screened?
When Pa Aman came to me and explained passionately why it is very important, he mentioned what we have done is around 2% or less. So, and then as a very ambitious person, I put a very high target. Now they reach 1.2 million. But I monitor weekly, because 1.2 million is the average, the total. And the total, statistic, I'm a physicist by nature. I like statistic in a way, I dislike statistic in a way also, because sometimes statistic, cover. several important facts. Another important fact is every week, I monitor this number weekly, now reach 60,000 on the average. Once we hit 80,000 tests every week, so yes, it's going like this and the average is 1.2, but if I just multiply 60,000, our December average weekly, by 52 weeks, that is already 3.7 million, already about 65% of the coverage. My target to my team, which is again, I'm a very notorious and ambitious person, I want to increase it to 90% coverage this year. So that means 90% of 4.8 million, you divide by 52 weeks, is roughly between 80 to 85,000 every week. And they are all screamed to me, but I said, hey, you are amazingly increased from only 1,000 every week to 60,000 every week in 12 months. So it would be very easy for you to increase from 60,000 every week to 85,000 every week in the next 12 months.
Yeah, it's a huge undertaking, but it sounds like, you're motivated to make it happen. Can I ask what level of staffing and resourcing has been required and will be required to establish and scale the program to this magnitude?
When we started, I believe we started with one central labs in Bandung, Rumah Sakit Hasan Sadikin, and several supporting labs, but not as aggressive as Hasan Sadikin. We realized that we need more labs. So we established 11 hospitals because we don't have a great public health lab infrastructure. Indonesia have a lot of clinical labs in the hospitals, but we don't have public health labs. I noticed that you are a public health expert. So that's why when we started this initiative, we didn't have the infrastructure yet. So we chose 11 hospitals to be the central public health lab to serve the whole nations. And we deploy instruments, health labs instrument, and also materials. We train the people in these 11 national public health labs. But the intention is starting this year, because we already received a grant from World Bank to help to develop a public health network across the country. Then we will gradually shift this responsibility to the provincial or regional public health lab. So we will develop the network of public health lab started from 10,000 puskesmas, and then 514 public health labs in cities, and then 34 regional public health lab in provinces. So I believe for this undertaking, because we want to increase from 60,000 to 85,000 every week, and also we want to add 2 additional tests, which is the CAH and G6PD. We would like to increase the number of national public health labs that can provide the services. Wow. So our target is 34.
Yeah.
This year.
So it sounds like it's grown a lot from just one lab at the beginning to so
and
much.
That was in 2022, if I'm not mistaken. 1 to 11. And our objective to increase it to 30 plus.
Yeah, it's huge. So in terms of spreading these resources out, I understand that Indonesia is a vast archipelago consisting of more than 17,500 islands. How are you making newborn screening available across such a big country?
That was the biggest challenge. Out of those islands, actually only 7,000 are inhabited.
Yes.
But still, 280 million spread over 7,000 inhabited islands is a huge task to fulfill. We are lucky that my predecessor, 20 years ago, 30 years ago, I believe in 1960s and 1968 or 69, Indonesian government established the public health facilities concept. So 10,000 puskesmas spread over 10,000 districts. So Indonesia government structure is divided by one country, 34 provinces, 514 cities, 10,000 districts, 85,000 villages, and 300,000 hamlets. So the government of Indonesia has established a network until district level, 10,000. So what I did is just revitalizing and utilizing this network. So the 10,000 puskesmas, we call it, the primary healthcare clinics owned by the government, are being revitalized, and one of their job is to do this newborn screening. Because what happened was the 4.8 million babies that are delivered every year, most of them are delivered at these puskesmas. So that is exactly the right place for us to do newborn screening. The issue is when we started this initiative, they are not motivated, or they don't know how to do it. And as a banker, I believe that money is one of the greatest instruments to motivate people. So we put a mandatory test for this newborn screening if they want to claim for the National Health Insurance Scheme. So they deliver the service, they will get reimbursed by our National Health Insurance Agency. And we put this as one of the criteria. So if they don't do it, then they will not receive the money. So that's why they are very motivated now to do it.
So the puskesmas.
The puskesmas.
That's it. So they've been very instrumental in
Yes.
reaching
Yes.
people in different districts and areas. So onto a different topic now. We talked about Indonesia currently is screening for congenital hypothyroidism. Can you tell me what impact you think newborn screening for this condition has had on child health outcomes so far?
So I will move, backward a little bit. Indonesia, the president, every Indonesian aspire to become a high-income country. And for me, which has a finance background for 30 years and only 3 years in healthcare background, I know exactly what high-income country is. It is where your GDP per capita above 13,000. So if you are above 13,000, then we will join Australia, we will join United States, Japan, other country, we will be recognized as high-income country. Now our GDP per capita is only 4,700. So we need to triple our GDP per capita. The second thing that I observe, historically, every country, every nation that successfully went into high-income country level, 13,000 per capita, they did that during a specific windows. It is during the peak of their demographic bonus. So where the productive population are the highest. It is very logical. Then they are producing money, they are producing GDP, so the GDP per capita is the highest. When they miss these windows of opportunity, so they pass this demographic bonus and start declining, the old elderly are start dominating the population, it will be more difficult for any country to breach this barrier, the 13,000 per capita limit. So that's why we notice some country already there and some country are forever stay in these middle income countries. We call it middle income trap in economics. And our peak of demographic bonus in Indonesia will happen in 2030. So it's only 6 years from now. So what I always tell many people, all the regulators, the next president, if we miss these windows of opportunity, then we make the greatest sin to our next generations. Because our next generation will not be able to enjoy living in high-income countries. They will forever live as a middle-income country. So it is very important, 2020 and 2035. This will be the next president. So I told the people, don't choose the wrong leaders, because when you choose the wrong leaders, we will miss this opportunity. That will be our greatest sin to our children and children of our children. Now, how, if the new leaders are there, what should they do for us to be able to break this $13,000 per capita barrier? For any people to have a bigger income, 13,000 per annum instead of 4,700. If I translate into rupiah easier, is 15 million rupiah. That is the target. The average monthly income for every Indonesian has to pass 15 million rupiah. Now the average is 5 million rupiah, 4,700. If you want to increase the income, it's easy. You have to have the healthy people and the smart people. So I said, after you choose a president, ask the president not to make a wrong decision and choose two ministers, the health ministers and the education minister. Because these healthy and smart are the basic requirement for any Indonesian people to increase their income from 4,700 to 13,000, or for 5 million rupiah per month to 15 million rupiah per month. So that's why it's extremely important to have a healthy population. Otherwise, our country will not be able to break the high income country barrier. Now, how to make this healthy? Then newborn screening is a very critical, component, how to make our people healthy. It also very critical component, what I learned from Prof. Aman, to make our people smart. Because if you identify you have a hypothyroid problem and you are not being treated, what I knew is what I'm being informed, then you will have an intellectual problem, intellectual disorder later on. So that's why very important to have healthy and smart kids to support Indonesia break the 13,000 per capita income and bring us to a high income country status.
Yeah, there's a clear connection between health outcomes and the outcomes of the country overall. And I think it sounds like your banking background has made that really helpful for you to connect. And it seems like you have led some really tremendous changes in Indonesia over your time as the Minister of Health. What do you think has been your greatest achievement for newborn screening?
I don't believe that I can reach this number, but I'm a very optimistic and demanding person to myself and to my people. And I know that Indonesia has a lot of social capital. I learned this during vaccinations. I have to vaccinate, 230 to 250 million Indonesian across 7,000 islands. It's extremely daunting task. It's extremely difficult. But then I realized that Indonesians have a lot of social capital. As long we can unlock this social capital, there are many people will help us, will help me. So as long as we create this not as a very exclusive initiative, but inclusive, we don't approach this as a government program, but like a people movement. So everybody own this initiative instead of only the government own this initiative. That would be very successful. So one of the reasons that I'm here with you is I want to spread this news across Indonesia and also across the world. So people knows that we are doing it and they will be very, very supportive. Pa Aman and the team is very helpful because he is persistently, broadcasting this in his social media so people understand, all the mothers understand, all other pediatrician specialists across the country are supporting this initiative. They're teaching the puskesmas, and then boom, we increase from 1,000 every week to 60,000 every week. We just have to involve more people, more inclusive, make the movement, bigger, and I believe we can hit 85,000 per week easily, and that will be a 90% coverage. I take a look for my competitor. I'm a very competitive person, I compete with India, China, United States. Some of them reach 100% already. So if we can reach 90% just in 2 years, that will be an amazing achievement.
Yeah.
But of course, if we can achieve 100% in the next 3 years, I will talk to my successor. Then, because I bring from 0 to 90, then you have to bring from 90 to 100.
Yeah.
That should be easier for him. That should be easier.
Well, you have already achieved so much growth already. So I definitely think, you've got promise to achieve so much more. And 90% can definitely be reached. What do you think have been the biggest challenges so far in achieving this?
Overcoming the inertia is always a challenge, especially Indonesia and also the bureaucratic government that we have. We are not used to work fast. We are not used to make a fast decision. We always see many problems that we don't have budget. It is very difficult, impossible to do it. Changing the attitude and culture is the biggest hurdle. But that is the role of people like me. If you have a team that your job is to make sure you change the culture, the attitude, instead of see only from the difficult angle, you see from the opportunistic angle and just push everybody, because we have potentials. But move forward, creating the momentum, maintaining the momentum is the biggest challenge. And if one leader successfully push and bring his or her team having a great momentum to move forward, I think it will move by themselves.
Yeah, it's important for the leaders to be able to help the people to reach their potential and use all the resources that they have. So my next question is, as we head into this new year of 2024, can you tell me what the vision is for newborn screening as we go forward?
My short-term ambition, my long-term ambition is I want to reduce the child mortality below 5 for every 1,000. Why? Because that is what the development. We are now, whatever is very high, close to, I think it's still above 100. I want to push it above, we are above 20. That is a mother mortality. So we want to reduce it below 5. That is my long-term ambitions. And we have several activities to reduce the child mortality below 5, and one of them is this newborn screening. And newborn screening, my short-term target, I want to cover 90% before I leave. Before I leave as a minister, I want to cover 90% of the newborn babies are screened. And then second target, I want to leave a legacy, at least 3 screenings. The CHT, CAD, and also G6PD. Yeah. And my third objective, I want to establish an ecosystem, an infrastructure. Establish the public health labs, the financing structure so it becomes sustainable, and also training all the doctors to understand the importance of this, educating the mothers so they demand when they are delivering the baby, they will demand to the healthcare facilities for the babies to be screened. And number 4 objective is to make sure that the treatment, the follow-up treatment, and the quality of treatment is there. Because when I see, yes, we have a very large number of screening, but the reject rate is high, and the positivity rate is below standard. So something is still not right. But for me, it's better to start first and then improve what we have. But we need to improve the quality of our screening, both in terms of the samples, how to take the samples, how to process the samples, and how to follow up if it tested positive.
Yeah, so you have a big vision for newborn screening. And so with the upcoming presidential election and changing government, how will you convince the next government to continue placing newborn screening?
The easiest way to convince is to convince the people. So that is the reason why I have you here, and also my friend from the pediatrician associations. Vox Populi, Vox Dei, the power, the voice of the people is the voice of God. The politician always mention it. So it's more difficult to convince the politician. But if you successfully convince all the mothers to demand to the politicians to do this thing for her, otherwise the mothers will not choose the politician, you're talking about more than 100 million folks. So that is the reason why I'm doing this. I want to spread this news to all mothers in the country, so they understand when you are pregnant and you're delivering your baby, if you want your baby to be healthy and smart, you have to do newborn screening, and it's given free by the government. So just ask.
Yeah.
And they are the one that will, they will make my legacy and Prof. Ahmad legacy sustain.
Yeah, people have a lot of power.
Yes.
Exactly.
Yes.
Which really helpfully leads me into my next question. What would you say to parents who aren't sure if they want to get their baby screened?
Make sure you come to the healthcare facilities and talk to the doctors and make sure the babies are healthy. That is the only thing for the mothers.
What advice would you give to other countries that are considering starting a newborn screening program? And what would you say is the importance of strong governance and leadership in achieving universal screening coverage?
Save your babies. For other regulators in the country, you just have to listen from the experts that you have. And while you are staying there, you don't have much time. For me, I only have 3 years and 9 months. Let's use that times to do good things for the people. Not many people has the mandate or the chance to sitting at this position, having a very powerful pen to sign any regulation. So let's use this time properly. Issue as many regulations that save lives. I think that will be a greatest contribution to humanity.
Well, Pak Budi, terima kasih atas waktunya. I'm honoured to have had this chance to learn from you about the amazing progress that Indonesia has had in newborn screening. I'm very excited to share this knowledge with other countries as they seek to achieve newborn screening as well, and we see it globally implemented. So, terima kasih.
Terima kasih. Selamat siang.